My topic was pneumothorax or hemothorax. What is it? So both conditions are going to result in a collapsed lung due to blood or air entering the pleural space. This is harmful because it reduces the lung's capacity, causing respiratory distress and gas exchange issues. It can also produce tension on mediastinal structures, inhibiting cardiac circulation as well as systemic circulation. All right, so as a nurse, following the nursing process, for assessment, when you're assessing a patient who's positive for either of these conditions, you will be able to notice dyspnea, unequal thoracic expansion, decreased breath sounds on affected side. For pneumothorax, you're going to notice, on occasion, tracheal deviation and hyporesonance, so upon percussion, things will sound hollow. All right, for the diagnosis part of the nursing process, typical nursing diagnoses would include ineffective breathing pattern related to decreased lung expansion as evidenced by dyspnea, risk for trauma, and risk for infection. So for the planning step, some possible goals for this patient would be patient will reestablish a normal effective breathing pattern by the end of shift. Second, patient will report decreased pain by levels by end of shift. And the third would be the patient will be free of signs of infection during care. So, implementing in the nursing process, some possible nursing interventions would include monitoring for any changes in vital signs, specifically oxygen saturations, blood pressure, heart rate. You're also going to monitor results of ABGs. All right, and next you're going to monitor the chest tube for signs of complications. For example, leaking will make the chest tube ineffective. At that point, you'd want to, find the source of the leak. Next, you would also observe the insertion site, also changing the sterile bandage as needed. Lastly, also note that the insertion of the chest tube is not in a nurse's scope of practice. That would be an advanced practice nurse, physician's assistant, or a doctor. Lastly, evaluation. So, in the end, when you evaluate this patient, you're going to ask yourself, is the patient free of cyanosis with an O2 saturation within normal limits? Secondly, you're going to ask, did the patient report less pain as evidenced by a decreased number on the pain rating scale? And lastly, you're also going to ask yourself whether or not the patient remained free of any signs of infection. That pretty much sums up pneumothorax and hemothorax.